to introduce our next speaker, and Dr. Rhonda Mattox. And she's someone that if you were to picture a Venn diagram like Adele had, she's definitely a physician, psychiatrist, but she's a speaker, a radio host. She's been an advisor to Hollywood on some shows in terms of the, let me look at my notes. Non-stigmatizing portrayals of mental illness. I wanted to really read that the correct way. The thing I want to say about Rhonda is that somebody a few years ago said, hey, you and Dr. Mattox need to meet. Y'all, I think y'all would click. And so we were like, okay, let's go meet. We went to have lunch. I think it was at Cantina Laredo, and like 3 hours later, we were still laughing, and she's like, I gotta go get my kid. So we always connect, and the thing about Dr. Mattox, or Rhonda as I call her, she is real. She's a real deal. She's a real person, and we would both be up here in yoga pants and tennis shoes and socks if we could. But she's also a fantastic psychiatrist, physician. I'm very picky, but I would refer my family to her. And she does do some work as a psychiatrist, as a consulting integrated psychiatrist with some FQHCs and prison?
Juvenile Detention Center.
Juvenile Detention Center as a consulting psychiatrist. So she's got the science, she's got the evidence, she's got the medicine, she's got the personality, and she's got some fantastic training. She was at UCLA. Got her training at UCLA and even with the National Institute of Mental Health. And so being in UCLA, that's where she got to advise Hollywood, and then she's been involved in advocacy at the Capitol, nationally and locally. And she just got back from a huge conference. We were just saying, she's like, well, I don't know why I committed to this. I was like, because we need you. There's people here that want to hear her message. Because she is the president of the Arkansas Medical, Dental, and Pharmaceutical Association, and the first psychiatrist to serve in that role in its 130-year history. She also still does host a radio show, so you can find her on Rejoice 103.3 and 105.5's Impact Zone. So I think you're going to enjoy Dr. Mattox. She's got a great message. But most of all, if you could just see into her heart and to know what a great person she is and how much she shares our mission of wanting to make people have less suffering and make our world better. So thank you so much for being here.
Did you all hear the circus music that I was intending for you to hear? Welcome, welcome, welcome to the circus. And I know you may not see elephants and tigers and lion tamers around, but if you've been living in Arkansas for the last 2 to 3 years like I have, then you know exactly what I mean when I say welcome to the circus. Today we are addressing the elephant in the room. And I know you may not be able to see the elephant, but I promise you can feel the elephant around with your peers, if not yourself. And that elephant, my friends, is burnout. Now, I know that she has done a phenomenal job of introducing me as all of these things that I have come up with to do. And it boils down to wherever there's a need and we are addressing mental health, I tend to fall in there. I love faith-based communities. I like reducing stigma. I have worked on shows like 90210 and different things, and I have some non-disclosures now that I really wish I could tell you about because you would be really excited, but I can't. And I'm doing some pretty amazing stuff. But today, I want to talk to you about burnout. And I am your game master. You see, we are in the circus, and I know that you want to know what it is we're going to do. By the end of this, I want you to know what burnout is. We have this nebulous feeling of what it is, but we're going to talk about what it is. I know that most of you, when you're thinking about burnout, you're thinking about the individual solutions to burnout, and you're talking about that. But burnout is not just an individual construct. We're going to talk about some of the organizational solutions as well, because that's really where it lies. And then we're going to end with your call to action to use your voice more and articulate what your needs are more, and not to do what we sometimes do, particularly here in the South, which is think that they should see how overwhelmed I am and not ask me to do one single more other thing. Can't they see? And then we get resentful of the people who ask us, when in reality, this is what's going on. It says, what is going on is that you have been faithful over a few things, and they're attempting to make you ruler over many. And so that is their vote of confidence, because baby, you do it without complaint. And that's what we're going to be talking about today. Now, let's get some ground rules together. We're going to be talking. This is not going to be me point and show you my beautiful slides. Don't they look lovely? We are going to actually do some engaging. And if you don't believe me, just watch. We're going to begin with a never have I ever edition, okay? Never have I ever. And for those of you who don't know how to play this game, when I say something, never have I ever driven a car. Everyone who has driven a car might raise their thumb, okay? So I have some clinicians in the room, I've been told. I have some peer counselors in the room, I've been told. But I'm just going to start with something that probably none of you have ever done. Never have I ever gone to work with laryngitis and wrote my questions down. Oh my gosh, stand up, tell me who you are. Who are you? Who are you?
I'm Amber.
Okay, what do you do?
I work at college as a biology professor, and I also do mental health counseling on the side.
Thank you. There are a couple more people in the back who raised their thumbs. What do you do?
I'm an RN population health coach, so my voice is my job.
Okay, so I'm a psychiatrist. Thank you. So I'm a psychiatrist. We have an RN and we have a teacher and a therapist who went to work with laryngitis. You all are in the health profession. You know that means you probably can't talk very much. You could go ahead and have us.
So I'm Lorraine. This was many years ago when I was a bedside nurse at ICU, and I need to like laryngitis and do exactly what you said, write down like what keys and everything.
Yes. Now, I can't tell you why they went to work, but I will tell you why I went to work. As a first-year resident, right out of residency, as a first-year psychiatrist, right out of residency, I went because I didn't want them to think that I was telling them a tale. I wanted them to know that I was committed to the team, and I wanted them to see how sick I was and say, Sugar Bee, go on home. You don't need to be here. But do you know what didn't happen? Nobody said, Sugar Bee. Because everybody is in there. And when you are going through the motions sometimes and you are a people pleaser or a recovering people pleaser, you are sometimes not championing for your own needs, though you are championing for everyone else's needs. You're not championing for your own. And then you are hoping that someone will be just like you. Because you would have said, Sugar Bee, go on home, we got this. But no. So at the end of this, we want to use our own voice. So I wasn't expecting anybody else in the room to be able to say that, okay? But thank you, I'm not alone. Never have I ever thought of driving my car in the ditch so that I could perhaps be admitted to the hospital so that I could get some rest. Look around, family. I thought I was going to be the only person to say that. Listen. What do you do, darling? I'm a registered nurse. Registered nurse. Family, check on your registered nurse friends. They are not well. Did I see anyone else with their hand up? Peer support. All right, check on your peer supports, your registered nurses, your psychiatrists. We're not well all the time. But the point of this game is for you all to understand that as far-fetched as I thought that was, and I thought I was going to have to do 2 or 3 additional ones, we have people in the room who did not use their voice when they were exhausted. And you all, nurses, know that you don't get rest when you get admitted to the hospital. Somebody's checking your vitals, give you, you are really not thinking wisely if you think you're going to be admitted to the hospital and get some rest, right? So burnout is the elephant in this room that we are walking around, putting lipstick on, dressing up, but it is here, and it's here in full effect. Now, let's get a common language. Physical, emotional, or mental exhaustion, plus decreased motivation, lowered performance, negative attitudes towards oneself and others. Now, this is a concept that we first heard about in a book. I can't remember, in a novel where an individual was talking about Graham Greene was talking about an architect that was experiencing some decreased motivation. And this came out maybe around the 70s. And then we had some other people catch a hold of it, try to scientificize it. That's not a word, but work with me here. And now, all of these years later, we have some different constructs that are here. Now, we're talking about the circus, right? So I want to know, as we're talking about burnout and what happens, many times we find that we're overwhelmed. And we're living in this circus. And so we're going to talk about what roles you are playing in the circus of this thing called burnout. Now, the circus. Tell me about the different actors in the circus. Who are they? I gave you a bonus, tightrope walker. We know, walking along a thin wire, trying to balance. What else? Ringmaster, yep. What else? Lion tamer. We got some lion tamers in the room? And if you don't want to say it out loud, just wiggle your toes. I'll be able to feel it up here, okay? What else? Say it again. Yep. They're doing the acrobatics. They're balancing, agility, motor coordination. They're performing. What else? Magician. Say it again. Magician. Oh, I never think about the magician at the, okay, good. What else? Fire breather, yes. Oh, I know there's some fire breathers in here because I know there's some people in here from Blue Cross Blue Shield. Just lower your heads. Nobody will know it's you, okay? What else? Clowns. See, she read my mind. Entertainer, wearing traditional costume, exaggerated makeup. I like the clowns in there. They make you laugh. They draw attention to places that you wouldn't ordinarily look. What else? Ticketmaster? Yeah, you got to get in the zoo. I think of those as the HR people. Anything else? All right. So I won't talk about the lion tamer and the cheer, but I want you to know that as we are navigating this circus, you have your tightrope walkers, you have your clowns, you have the people who are taking the swords, you have your acrobats, you have all these people who are doing this, and you have your jugglers, family. Dr. Gibson told you about the juggling, okay? And if you are a parent, you know about the juggling. If you are a caretaker, you know about the juggling. Caretaker for a mother, and all of us are in that age range. And so when we go to work, we are going to work and we are supposed to be productive. But when we go to work, what are we taking to work with us? We're taking our additional roles because we wear many hats in the circus and we are balancing and you're walking this tightrope. And until the pandemic hit, many of us we were walking and we were balancing. But the pandemic hit. And am I still on? Can you still hear me? Can you hear me? Oh, there you go. All right. you tell me if I got it? Did I get it? But you know what? I'm going to keep on talking and writing questions. So we were juggling and we were balancing and we were walking and we were line taming, particularly if you had kids or you had a boss who was a little bit fruity and and so the pandemic hit and they're talking about the great exodus. And we saw that a lot with healthcare providers and teachers. And what happened was that some of us were already burned out and we were doing this fine dance. And then we got exhausted. And just think of exhaustion as like chronic tiredness, chronic fatigue, depersonalization. Your motivation is down. You are kind of looking at the things that you used to enjoy, you're looking at the people that you serve, and you don't appreciate them very much. And I saw a lot of this, particularly with healthcare workers who were like, if you don't get the vaccine, then maybe you shouldn't be able to come into the hospital. Now, these are people who were normally very thoughtful and what have you, but some of the things that I was hearing from my peers, and if I'm telling you the truth that I thought myself, didn't sound very compassionate. And then there's this lack of sense of personal accomplishment, like, what does it even matter? Why does it care? These people don't care. And when I was younger, the best jobs in the world were teachers and doctors and people who help, therapists. You were looked up upon. But during the pandemic, something happened, and they didn't like us very much, and so we didn't feel appreciated. And lack of appreciation is a really huge thing. And not having control is a really huge thing in burnout. It really factors in. And now, before I talk to you more about burnout, I got to tell you why we're talking about this, because I am like a heart person, but I'm married to a finance guy who's dollars and cents. And so when I come home and I say, it's just the right thing to do, well, he doesn't always care about the right thing to do. I have to make a dollars and cents case. So I'm going to start with a dollars and cents case for you, though you probably already know this. When you have burnout, do you know what you want to do? You want to quit. You want to exit. Stage left. And the economic cost of turnover, estimated that losing an employee can cost a company 1.5 to 2 times the employee's salary. Now, I know that you've probably heard somewhere or another, hit the road, Jack, and don't you come back no more if you don't like the way I do it. But that philosophy can really cost a company a lot. And so depending on the individual's level of seniority, the financial burden can fluctuate. But for hourly employees, that can be like a cost of an average of $1,500 per employee, depending on what you're looking at. And you got to factor in the recruitment and the replacement costs, the lost revenue during the interval between a departure and new hire, and not just the lost revenue, but while you're trying to hire somebody, the other people have to pitch in. And then they are more likely to be like, you know what? About that. And if you were a nurse and you were not feeling appreciated during the pandemic, there were some ICU people who were willing to pay you what they were paying pediatricians and family medicine docs. And so you really could just leave. Now, the economic costs, of course, vary by specialty. Because I'm a physician, I threw this in. Ballpark estimate across all specialties is 2 to 3 times the annual salary of the physician, which means at least $500,000 when you're talking about recruitment, replacement, hiring those companies to bring somebody in. Now, I'm making this case because while most of us in this room may not care about this, there may be some people who are in HR or some people who are owning the companies. And I need you to understand the cost of burnout so that you can prioritize doing something about it. So let's look at it. What does burnout actually feel like? I gave you some fancy terms. I used depersonalization and lack of motivation. But what does it feel like when you're experiencing it? And what does it look like in yourself or with your colleagues? And this is not a rhetorical question. Talk to me. Yes? Tired and depressed. You may get to the depression, but not quite there. That may be towards the end of it. Yes, but you introduce a point that I definitely want to talk about because many times it's safer to say I'm burnt out than to say I'm depressed. And so sometimes we're actually depressed, but we're calling it burnout. So we'll talk about that. Did I see a hand over here? Angry, yes. You can get angry and frustrated. Yes, apathetic. It's just like, yeah, I mean, like sometimes you can feel the apathy. I feel like you can just feel it. You can feel it when you enter a room sometimes. Did I see a hand over here? Irritated, can get annoyed really easily. And the interesting thing is, have you ever met a genuinely sweet person from the time they walked through the door and then you saw the light go out of their eyes and you saw the snappiness and you saw all of that and you saw it and you felt helpless to do anything about it? Have you ever witnessed that? I've witnessed it. Anyone else? Oh, that's excellent. It's presenteeism. So sometimes when you have burnout, you have absenteeism, but sometimes you have presenteeism. And so you go to work, you may be tardy, but you go to work, but then there are some cognitive things that are happening to where you're kind of slowed down and you miss deadlines, you miss projects, you may miss appointments, forget, because with the emotional exhaustion comes the cognitive slowing down of. So that's an excellent point. Anyone else? So now let's talk about some of the risk factors for burnout from an organizational span and an individual span. We talked about what it looked like, but now what are some of the risk factors for people developing it? What does the company look like, or how is it structured that makes you more likely? Yes? Lack of support? Lack of support? More focused on billing than the wellness? Too many tasks, overworked. Inflexible schedules, yes.
Not having clear expectations, like nothing is expected and it's never
Yes. Oh, that's really good. What she said was not having clear expectations and then everything is expected. And I'll say, and there's not always a clear timeline. Everything becomes an emergency. Like, we could have been working on this all along, but now they want you to cancel your plans with your husband, cancel date night, cancel the appointment with the kids so that you can work on something that they knew was happening months ago. Anything else? Closed door, no recourse. Good. I remember, for me, communicating at a particular job, and I would meet with the CEO and talk about some of the issues that I noticed were happening, and he would sound like he was going to do something about it, and then nothing would happen. And so I was giving feedback, and I was getting the nod, and then everything continued. And so it felt like I didn't have input into the organization. Inflexible hours, not those kinds of things. Anything else? Yes?
Lack of personalized contact from administration, so everything just like disseminates like currently.
Lack of personalized contact through administration. Good. Tell us a little bit more about what you mean when you say that. Yes?
Randomly getting, emails or, notifications that things are happening with no buy-in or anything.
So no feedback into it. You get the directive, but no input is, I think.
No understanding of why.
No explanations, yes. I think I saw someone's hand over here.
Also expecting the employee to deal with their own burnout and make them feel responsible to cope with their own burnout without providing any.
Good point, good point. So we've heard a number of things and all very relatable. what about on the individual level? And you'll notice I started with the organizational level because many times when we're talking about burnout, we are a personal responsibility nation, right? An individual responsibility. But many of the things that we just talked about are things that we as employees may not have any control over. You don't have any control over the rollout or the absence of communication many times, the not understanding the why. And a part of what happens with burnout is many times we do forget our why, and it feels like there's not a lot of, we just forget our why. And we forget about why we got into it, the people that we want to serve, and it becomes focused on billing, and it becomes focused on completing tasks, and it becomes focused on some nebulous thing that we don't really buy into, you know? I see your hand, sir.
I mean, even just being a mission-driven organization, I mean, you said forgetting the why, but I mean, the why, being in the forefront of every thought you have, helps you make the choices that let you devalue yourself and your self-care because you're out there just, oh, I got to see this next person, or I have to do this. And I say that as a former C-suite executive at a large healthcare company. You know, I was writing those communications, I was caring for patients, I had the ability to change things, and it's still, even at that level, it's just hard to put yourself in front of.
That's an excellent point. And I will throw in one additional piece, and that is sometimes you see employee morale and things go down because poor behaviors in other employees are not dealt with, and employees who act out and who do all kinds of inappropriate behaviors are not corrected, and then their work is taken from them because people don't feel like dealing with them rather than correct it, and then it's given to someone else who's more pleasant. And that piece right there, that can be emotionally take an emotional toll on you as well.
Negative talk about the administration and how they run things, and that spreads, and everyone gets in that negative.
Yes, because burnout is contagious, believe it or not. And I'm just going to spend a couple more minutes on individual level because I really want us to get to solutions. Yes.
So we all have a sense of self-worth, and so there's an expectation of receiving gratitude periodically, and when you do your job, the gratitude doesn't come.
Oh, that's excellent. Absolutely. Appreciation, gratitude, those types of things that, makes it feel like a good thing. And by nature of the work that you do in addiction, in mental health, many times the people that we're serving may or may not have the capacity to offer that to the people that we're serving, but certainly we expect to see it or to feel it on an organizational level, and when it doesn't come, that can feel very disappointing. Individual level. All right.
A lot of support.
I think having too much on your plate is that you're having to do work, maybe extra work, and then you don't have your family life and everything else going on, and so that can really get you down.
Absolutely. Lack of support, a lot on your plate, maybe have existing mental health issues already.
Being a perfectionist.
Oh, this lady. Yes, yes. And I'm going to tell you something. Some of you know Nate Smith. He was over the Arkansas Department of Health. He was courting me to be on a board, and I gave him that perfectionist rhetoric. I will not have the time to do it at the level, da-da-da-da-da. And Nate Smith said to me something I've never heard anybody say ever, and I probably will never hear anybody say again. He said, anything we're doing it half A. And I was just a little bit baffled, and I was like, what? And the explanation was this: Rhonda, your expectation of yourself is someone else's 300%. So if you give me half, your half is going to be someone else's, is going to be much more than someone else's 100%, because they don't get it. And I thought, man, you know? And so now I try to push myself not to be that perfectionist, but I will tell you, I'm not exactly there yet. I'm in recovery, but I'm not a former one yet, okay? So that was a great point. So you all have painted me a picture. Anyone else want to weigh in before I move on? Yes. Oh, I didn't pay you to say that, did I? She just nailed it. She summed up everything. The lack of work-life balance is it. Now, I'll make reference to physicians, but in the pandemic, what we discovered was that the not-so-breaking news of the people who were experiencing the most burnout, and I think this can be applied to most people, the females were, because you can extrapolate that they had a lot more maybe parental responsibilities, caretaker responsibilities of mom, of parents and stuff like that. Physicians under 65 and physicians employed by a federally qualified health center. Those were the physicians that reported the highest level of burnout. Now we started talking about this, the Great Resignation in 2021, and they were talking about this. But let me just tell you something. And you can't see this. Man, I hate that you can't see it. But in 2015, they were talking about this. In 1999, they were talking about this. It's just during the pandemic, people started exiting stage left. So we were feeling it, but we weren't necessarily leaving. But during the pandemic, we were just like, I'm out. And I'm not sure that it was because we had to be out, or if it was because there was so much inflexibility, right? Because if you could work from home, maybe you could continue to do it. But doing what you all do, maybe work from home was not an option. For me as a psychiatrist, working from home was like the only way I was going to be able to work, period. Because I had people who were compromised, and I would not feel okay if I brought something home to them and killed them. So now let's talk about solutions. And we're going to talk individual, and we're going to talk organizational. And so I have all the solutions I need in here. Now I got another slide in case you guys are kind of slacking, but let's but let's talk solutions. And I think I was told I have an hour, but let me confirm that so that I don't have to rush and miss my slides. Okay. Now, I'm not going to take my whole hour, I promise. I promise I'm not, because I know what stands between me and your eating and your next, I'm not going to do it. Individual solutions. What are they? Ooh, I didn't plan her, but she nailed it. Set boundaries. But you know what? Setting boundaries sounds easy. Saying no, it is easier to say supercalifragilisticexpialidocious for some of us than to say no. Because in part, we're raised in the Bible Belt. We're taught, your parents teach you, if you can't say something nice, don't say anything at all. And at some core, we start to understand no is not something nice. But when you can start saying no, not just for the sake of saying no, but so that you can say yes to your child's soccer games, so you can say yes to the romantic dinner out, so you can say yes to your mental health, right? And so that learning that no, that setting boundaries is so critical. And I would tell you right now, for everybody in the room, get yourself a therapist or a coach if you want to know how to say no. And I know you don't have any mental health issues, so you say, I understand. Right? Wink, wink, I know. But let me just say this. In the middle of a pandemic, those of us, most of the people who are in here are considered the superheroes in our community. We are the people that folks come to, right? And so we were balancing our stuff, and then other people were coming to us, and then we were losing people, and then we were concerned about our finances. And I remember 4 months into the pandemic, my brother, who doesn't answer the phone, who doesn't respond to text, who doesn't call unless somebody's dead, sent me a text. And it said just a few simple words. Hey sis, how you doing? Now, if anybody in this room had sent me that text, I would have sent the perfunctory, I'm fine. But because it was my brother, who never, ever, under any circumstances, reaches out normally unless somebody's dead, I thought about it. And then the waterfall started pouring, because I was 4 months in as a psychiatrist who, generally speaking, work part-time, 3 days. I mean, I had a good life. I was working 6-hour days, right? Because I didn't go into healthcare to like be stressed. So I was really, so I had a good life. But in the pandemic, I had people reaching out to me saying, I can't get them in, who do I see? And so I started a business, a private practice in the middle of a pandemic without a website, without a professional email, and without a professional phone number. And I didn't intend to. I just started seeing people for free because I couldn't let some of the stories I heard wait 3 months because it was critical. And so then I built the business while I was flying the jet, right? But I was working 7 days a week to 10 o'clock. And did I mention that the school district decided that I was going to homeschool my child? And so I get off from work at 6, and then from 6 to 10, I'm fielding my colleagues' fears, my family's fears, and I hadn't even thought about how I was doing. And so 4 months into it, when he said, how are you doing? I realized I wasn't practicing what I was preaching, and I was tired, and I was exhausted, and I was scared. But I had to numb out in order to get to it, which is not what I tell my patients to do, I might add, right? And so that whole setting boundaries and that whole checking in on yourself and putting yourself on the list, you know, some people say you're at the bottom of the list. Heck, I wasn't even on the list. Is there anybody, now don't raise your hands, just wiggle your toes. Anybody in here who is not even on your list? This is what you need to do, individual solution. Put yourself on the list, pencil in getting your stuff taken care of. What else? Individual solutions.
Probably say like the juggling the plates thing, like making sure you're not the only person that knows about the plates you're juggling. That somebody else can maybe help you, or at least they know about it, maybe can help you balance it better.
Yeah.
You're not
That's good. And that speaks to what we'll get to with organizational stuff as well. Your personal stuff, but also organizations. I remember during the pandemic, I was working, when it first started, I was working for First Choice, or for one of them. And what they started to do was to have 1 week where the nurses were on, and then 1 week where the nurses were working from home. And they would shift it so that if you happen to get COVID or whatever, there was this balancing act, but other people knew how to do your job, so they started training. So having other people trained in your job is really good. All right. One more.
Communication asks what the expectations of you are, but also your expectations of whatever.
Yeah, that's good. That's really good. That's really good. Communication. Now, so I'm going to get to the organizational just a bit, but the tips to reduce burnout: set boundaries, communication. Anybody else?
Well, I would say if you realize that I need to say no, you don't have to apologize for it or make excuses for it.
Yes. Now, one of my other roles is coach, and so I do coaching for hospital administrators, some of the vice presidents, and some of the nurse managers, because many times you have nurses who are and it's traditionally nurses, just a few docs, but you have people who are sometimes they know that this person looks like they're about to fall off, and they want to bring someone in, not as punishment, though sometimes I'm involved because of punishment, but because otherwise they're going to lose them. And so one of the things we work on is how to set boundaries, how to say no, and then we write scripts for it. And so we will set up 3 different scripts that they might feel comfortable, because many times something will happen and you're like, I should have said no, what was I thinking? And you're like beating yourself up. And so we will, whenever that happens and they come in, we'll say, what do you wish you had said? what feels comfortable. And then we will develop a script. And we'll have like a serious script, depending on who it is. And then we'll have like a little humorous script, so you can inject humor, so you don't seem so serious or whatever. And we'll develop 2 or 3 different scripts, so that when this happens again, and it will, I promise, that you can do this. And we'll do this for, sometimes when you're in board meetings and people can't hear what you said, but they can hear what someone else said, and you just said it, and you just said it almost exactly the same way. And so, tap the mic. Is this thing on? Because I guess you didn't hear me. Or, oh, I'm so glad, that such and such agrees or whatever. Perhaps we can da-da-da-da-da. But, acknowledging that, hey, I said that now. And so we'll have some scripts to work through the setting boundaries and the no's. Great points. Anyone else? Yes?
Having someone like an accountability partner that can help you keep your boundaries.
Yes, absolutely. And of course, I'm going to say one more time, therapist. And I didn't finish my statement the last time because all of us lost somebody. And because it takes so long to get into a therapist, you want to see somebody while you're not at rock bottom, so that you can choose wisely, so that they can understand your patterns. And if you think about it, at least once every 3 months, someone will have upset you at work, at home. You'll have a dispute with a partner. Your kids will be acting berserk. Somebody has died. Your partner, somebody has died. Something has happened. And so identifying in the middle of this pandemic someone before you need them is self-care. And why do I say that? Because I used to have friends that I could talk to when I had a bad day. Well, after they lost people in a tornado, they've had deaths, well, my bad day seems like it's not a big deal. I don't want to burden them with my bad day. So the people that I used to be able to fall back on and talk, I can't. You don't feel comfortable doing that. So that is the point of having a therapist, so they can meet you when you're not at rock bottom. And I know all of you say, I just talked to my pastor and he'll work it out. I talked to the Lord and he'll work it out. I talked to my friends and they'll work it out. What you're paying for, and you already know this, but I'm going to just say it aloud. What you are paying for is confidentiality. Now, I've had one of my friends I've had since I was 12 years old, but I've had some other friends that have changed over the years. You will never, if you see a therapist, have to worry about when you break up with them, seeing your business on Snapchat, Instagram, Facebook, LinkedIn, or any such thing. So remember, if you don't remember anything about tips to reduce burnout, remember, find yourself a therapist before you need them, because it's hard. It takes a long time to get in to see one. All right.
So making a list and prioritizing tasks between what I have to get done today and what is a revolving task.
Mm-hmm. That's good. And I like that, making a list and putting it on your calendar, because there's nothing like being double booked and exhausted. All right. So on the individual level, we're talking about workload, job demands, efficiency and resources, stress management, self-care, exercise. Somebody over here said gratitude, professional coaching, mindfulness, resiliency, organizational skills, just like what you just mentioned, personal efficiency. And this personal efficiency is really important, because if you are doing something that you don't enjoy doing and you are cognitively slowing down, it's really, really hard for you to get that done. Now, if you gave me something that had to do with some Excel files and some spreadsheets, however, that would light up my husband's face. If you told my brother he had to come and talk to you all, I would have to give him Xanax or something similar, propanolol, for from the day he accepted it. And so sometimes our efficiencies, our personal strengths are not lined up with the work that we're doing. And have you ever had somebody that brought the energy and the fire, but you made the mistake of hiring them as an administrative assistant, and they did not have the skills of filing and typing or whatever, but then you fired them, and then the whole office climate changed? You should have put them somewhere else to where you could still have that. And then there are personal factors that may affect work life, like what we talked about, what you're handling. Organizational. Now, man, I want to spend more time on this organizational, but we'll make this. Shorten shifts. If you're working 12-hour days, 7 days a week, like I know somebody who's doing right now, I already know with 2 little kids, burnout is on the way. She's the only person who doesn't know it, but we all know it. Productivity targets. And don't move the productivity targets, like have them stay there, whatever, or adjust if nobody's meeting them. Method of compensation. I was on Saturday with someone from Eastern Arkansas Family Health Clinic, family health practice, and they talked about the fact that they increased their pay. Nobody in their organization makes less than $20 an hour. And the CEO was saying the reason she did that was because the people were working 2 jobs. So they leave there, and then they were working 2 jobs, and it was a recipe for burnout. So just increasing the pay reduced her turnover rate. And you know what turnover rate can do for your company, right? And the morale of the other employees who are pitching in while they're waiting. Modifications to work processes and flow. I cannot overstate that enough. I cannot overstate that enough. Figuring it out and what works. Of course, if you have an EHR, electronic health records are one of the #1 reasons that physicians and therapists leave their practices because they're sick of it. And I can tell you, my last 2 or 3 jobs that I've left was because of electronic health records. Even though I love the place, I was just like, Ruth, don't you tell anybody, okay? Use of scribes and APPs. Flexibility over start times and work hour distribution. If you have an opportunity to give a little bit of remote time, particularly if you have parents, people who are in caretaker roles, that will save you some turnover, I promise. Policies regarding scheduling requests, cross coverage, vacation, sick leave, maternity and paternity leave. As a mother working in a place that required I give them 3 months notice, and the school didn't give me 3 months notice, the school would give me 1 week's notice, 2 weeks notice. I could tell the school, but they weren't listening. And so, 3-month notice for vacation time, like that sounds really good if you don't have kids or other responsibilities or a life outside of work, Time banking system, access to self-care resources. Did I leave anything out? Man, I thought I'd be done by now. You guys talk, thank you. So I'm going to actually read this slide. I don't want to miss anything. Professional well-being is driven by the work environment and organizational culture, much more than by individual factors like grit and resilience. And that's how we've been deceiving ourselves with this burnout, thinking grit, resilience, individual factors, when so much of what we have going on that impacts your burnout is related to organizational change. Meaningful change in the work environment. This is a result of executive level leadership, strategy, infrastructure, resources, systems-based approach. If there are 3 things that are really weighing you down and it's making it hard for you to enjoy that, if the people at the top would consider some of the other people who are good at that, and you guys maybe shift some responsibilities so that it falls within the things that bring you joy. Now I can't imagine accounting bringing anybody joy, but guess what? It brings my husband joy, And so there are some people that we may have in mismatched positions or doing mismatched responsibilities that just making that shift could really help. A well-being task force. I had never heard of this, but I thought I loved it. Appointed by executive leadership can set the foundation for the work. And the issue is that it has to be the right people. Have you ever met Debbie Downers and nagging Nancy's? They should be on this task force. So you have to, you absolutely 100% have to make it a point to have the right people on this, people who bring confidentiality, so that when you're making these suggestions, that other people who maybe they put the policies in place, they don't feel attacked. So there are people who are diplomatic who can also navigate that as well. So a well-being task force, an appropriate well-being task force appointed by executive leadership can set the foundation for this work and bring other leaders on board, because you need a champion, and then develop an approach tailored to the needs of the organization. Every organization will not work the same. And sometimes we try to put a cookie cutter approach in there, and it's just not going to work. Now, this speaks for itself. If you know that you are operating on E, don't do what I do. Don't do what I do. It's another gas station over there that is a half a cent cheaper. I'm going to go over there and get it. No, don't do that. When you notice that you're tinkering out, that is the time to pay attention to adjusting and adding joy to your calendar, adding breaks with the girlfriends, adding things that you can do on at work that are morale building. Now, I'm not personally going to participate in a potluck in the middle of the pandemic. However, I have, we have done some 4-H club activities to where we were doing things, having some things that bring you together, whether that be a night out at the opera or something where you're talking and getting to know each other. For me, my organization, we brought Toastmasters. Toastmasters, and for some of you who don't know what it is an opportunity where you get to know your colleagues. And so there's this part of it that's called table topics. And you get to know your colleagues, you get to understand what their interests are, what their values are, and then you figure out ways that you can partner. I did this with my organization, Arkansas Medical, Dental, and Pharmaceutical Association. And it really was a game changer in terms of us getting to know what was important to each other and then working together. I've already talked about this. So in conclusion, resources. Resources for you on the individual level are things that you already know about but you have forgotten about. And that's employee health, employee assistance programs. That's therapists, that's coaches. Many times, as I've said, organizations who are vision-minded will know to get coaches for their leaders or they're going to lose them. And they will do those kinds of things. As it relates to individual levels, certainly, you look to your left, look to your right. Each of you are resources. Many times when we're struggling, we stop talking because we don't want to bleed on others. But find yourself a confidential, optimistic person that you can talk to. And did you hear what I said? Confidential, optimistic. Because many times what we do is we find other people who are disgruntled, and then they make it worse. Questions? No questions mean that I have either thoroughly confused you or I nailed it. I'm going to lean towards maybe I nailed it, and I'm not going to go with the utterly confused. I want to also thank Dr. Patty for inviting me, and all of you for staying and listening to me during lunch when you could have been chit-chatting with each other. I hope that you gained something, and if you want to reach out to me, I'll have my slide. But happiness is when what you think, what you say, and what you do are in harmony. Perhaps this was a slide from earlier. Maybe I wouldn't have included it. That's all, folks.